In this video, I'll cover 18 high-yield psychiatric medications explaining how they work, why they're effective, and what causes their side effects. 1. Haloperidol Haldol. Class typical antipsychotic. MOA blocks D2 dopamine receptors in the mesolimbic pathway. Why it works: reduces psychosis e.g., hallucinations, delusions by lowering excess dopamine. Why it causes side effects: also blocks dopamine in the nigrostriatal pathway, which controls movement, causes EPS extrapyramidal symptoms like dystonia, tremor, and stiffness. Tip: hold the dope. Haloperidol blocks dopamine, psychosis improves, but motor side effects happen because it blocks movement-related dopamine. 2. Clozapine Clozaril. Class atypical antipsychotic. MOA blocks D4-D2 dopamine and 5-HT2A serotonin receptors. Why it works: treats positive and negative symptoms like anhedonia, with low EPS risk due to different dopamine targeting and serotonin balance. Why it causes side effects: suppresses the immune system, can lead to agranulocytosis, low white blood cells. Also causes myocarditis, heart inflammation, possibly from immune overactivation. Tip: SAD clause. Treats schizophrenia deeply but requires blood tests weekly. Watch for WBC 3000 or ANC 1500. 3. Fluoxetine Prozac. Class SSRI selective serotonin reuptake inhibitor. MOA blocks reuptake of serotonin, more serotonin in synapse. Why it works: helps with depression and anxiety by improving serotonin signaling. Why it causes side effects: too much serotonin can overstimulate the brain-body, serotonin syndrome, GI upset, sexual dysfunction. Tip: happy with serotonin. Serotonin mood boost. Too much, sweaty, shaky, clonus, serotonin syndrome. 4. Atomoxetine Strattera. Class NRI norepinephrine reuptake inhibitor. MOA boosts norepinephrine in the prefrontal cortex. Why it works: increases attention and control in ADHD. Why it causes side effects: metabolized by the liver, can cause liver damage and dark urine. Also leads to appetite loss, mood swings, insomnia. Tip: strategy for focus. Non-stimulant ADHD med. Check liver labs if urine dark or upper right belly pain. 5. Lithium Lithobid. Class mood stabilizer. MOA affects second messengers e.g., inhibits inositol monophosphatase and modulates neurotransmitters. Why it works: stabilizes mood in bipolar disorder, especially mania. Why it causes side effects: works inside cells that also control kidneys and thyroid, leads to polyuria, hypothyroidism, and tremor. Toxic at high doses, narrow therapeutic index. Tip: lith, leukocytosis, intention, tremor, thyroid down. Hydration is key, toxicity if dehydrated. 6. Buspirone Buspar. Class anxiolytic non-benzo. MOA partial agonist at 5-HT1A serotonin receptors. Why it works: reduces anxiety by gently normalizing serotonin. Why it causes side effects: slight serotonin activation in other areas can cause dizziness, headache, nausea. Tip: bus calm but slow. Takes 24 weeks to work. Good for general anxiety. No sedation, no addiction. 7. Donepezil Aricept. Class acetylcholinesterase inhibitor. MOA prevents breakdown of acetylcholine, increases ACH in brain. Why it works: helps memory and thinking in Alzheimer's by improving cholinergic function. Why it causes side effects: ACH also works in the gut and heart. Leads to nausea, diarrhea, bradycardia, slow heart rate. Tip: don't forget donepezil. Watch for slow HR and GI issues. Take with food to reduce nausea. 8. Bupropion Wellbutrin. Class NDRI norepinephrine dopamine reuptake inhibitor. MOA boosts norepinephrine and dopamine. Why it works: improves motivation, focus, and mood. Also helps people quit smoking. Why it causes side effects: can lower seizure threshold, especially in high doses or eating disorders. Tip: boosts mood. No sex side effect. Do not use with seizures or bulimia. Can cause dry mouth, insomnia, weight loss. 9. Risperidone Risperdal. Class atypical antipsychotic. MOA blocks D2 dopamine and 5-HT2A serotonin receptors. Why it works: reduces both positive symptoms, hallucinations, and negative symptoms, anhedonia in schizophrenia and bipolar. Why it causes side effects: D2 blockade in pituitary gland, prolactin causes gynecomastia. Amenorrhea also causes EPS at high doses. Tip: think, risperidone raises prolactin. 10. Olanzapine Zyprexa. Class atypical antipsychotic. MOA blocks D2 and 5-HT2A receptors. Why it works: balances dopamine and serotonin, effective for mood and psychosis. Why it causes side effects: strong histamine and serotonin receptor binding, sedation, weight gain, metabolic syndrome. Tip: Zyprexa Z sedation pounds weight gain. 11. Varenicline Chantix. Class smoking cessation agent. MOA partial agonist at alpha-4 beta-2 nicotinic receptors. Why it works: reduces nicotine cravings and withdrawal. Why it causes side effects: mild brain stimulation and receptor blockage, vivid dreams, nausea, mood changes. Tip: VAR vaping alternative remedy. Watch for neuropsychiatric symptoms. 12. Naltrexone Revia. Class opioid alcohol antagonist. MOA blocks mu-opioid receptors. Why it works: stops euphoria from alcohol and opioids, reduces craving. Why it causes side effects: can cause withdrawal if opioids are still in the system. Liver toxicity with long-term use. Tip: no addictive liking today. Check LFT's liver function tests. 13. Naloxone Narcan. Class opioid antagonist. MOA rapidly reverses opioid effects by blocking receptors. Why it works: reverses respiratory depression in overdose. Why it causes side effects: short half-life, resedation possible, may cause withdrawal symptoms. Tip: Narcan narcotics cancelled fast. 14. Disulfiram antabuse. Class alcohol aversion. MOA inhibits aldehyde dehydrogenase, builds up acetaldehyde. Why it works: makes drinking feel horrible, discourages alcohol use. Why it causes side effects: even small alcohol exposure, e.g., mouthwash, nausea, vomiting, flushing, headache. Tip: D for danger if drinking. 15. Lamotrigine Lamictal. Class mood stabilizer anticonvulsant. MOA inhibits voltage-gated NOT channels, less glutamate released. Why it works: stabilizes mood in bipolar depression, prevents seizures. Why it causes side effects: may cause Stevens-Johnson syndrome rash if titrated too fast. Tip: Lamb low and moody. Start low and slow. 16. Diazepam Valium. Class benzodiazepine. MOA enhances GABA receptor activity, more CNS inhibition. Why it works: calms anxiety, relaxes muscles, stops seizures. Why it causes side effects: sedation, respiratory depression, dependence, withdrawal risk. Tip: D for drowsy dependence. 17. Lorazepam Ativan. Class benzodiazepine. MOA same as diazepam, boosts GABA. Why it works: used for agitation, anxiety, alcohol withdrawal. Why it causes side effects: can cause sedation, amnesia, and withdrawal with long-term use. Tip: low dose, works fast in elderly. 18. Phenelzine Nardial. Class MAOE monoamine oxidase inhibitor. MOA blocks MAO enzyme, increases serotonin, dopamine, norepinephrine. Why it works: for atypical or resistant depression. Why it causes side effects: tyramine foods, cheese, wine, hypertensive crisis, SSRIs, serotonin syndrome. Tip: PHENEL foods and headache emergency, no cheese, no SSRIs.